Governments across Europe are battling to bring under control a second wave of the coronavirus. Spain has declared a state of emergency and will impose a nighttime curfew. That's after confirming it's now recorded more than 1 million infections since the start of the outbreak, and almost 35,000 people have died in that country. The United States, meanwhile, this weekend recorded its largest daily infection rise with 84,000 new cases. To talk more about the spread of the coronavirus in Europe and the United States, let's bring in Professor Helen Rees, the chairperson of the South African Health Products Regulatory Authority. Prof, a very good evening to you. Always great to have you on eNCA. So the United States, as I was saying, has now recorded 84,000 new COVID-19 cases in a single day. Most of Europe is now recording, what, about 10,000 or more new infections daily. Are any of these trends surprising?
Well, the size of them, I think, has surprised us. But did we predict that there would be these big second waves? Yes, we did. And remember that what's happened in Europe is that they had hot temperatures. People were going back to a sort of relatively normal way of doing things, but sitting outside restaurants and bars and so on. Now the temperature's dropped. People's behavior is changing. They're going inside and into poorly ventilated spaces. And we don't also know whether the drop in the temperature has also had an effect on the virus and made it more transmissible or gives it a sort of bit of a kick, because if we understand from other coronaviruses, they don't like hot weather and they prefer cold weather. So all of this together means that we're seeing this big resurgence in Europe and this ongoing terrible outbreak that's going on in the United States.
And Prof, would it be fair to say then that most of what we're seeing as far as this second wave is due to human behavior?
Well, it's a combination of this virus with human behavior. Just remember, this virus is a very transmissible virus. So if I'm standing fairly near you and I cough or I sneeze, the air is full of particles with virus, and it gets straight into your nose, and there are receptors in the nose just waiting to welcome this virus in. So that's the virus. And if we don't wear masks, and if we don't socially distance, and if we're not aware of things like trying to keep windows open or trying to meet outdoors if we can, then we're giving the virus an ideal environment in which to spread. So it is a combination of the way this virus spreads, but also our behavior. And at the moment, the only thing we have to contain this virus, in the absence of a vaccine, is our behavior.
And it's been interesting to note, you look at France, for example, announcing a curfew, a nighttime curfew from 9 p.m. until 6 a.m. Parts of Europe are now shutting down bars and restaurants. A lot of these measures were measures that South Africa was criticized for at the beginning of our lockdown. To what extent were we ahead of the game, if you will, as far as what was needed to really clamp down on the spread of COVID-19?
Well, we really did have, as we all know, a very hard lockdown, and that did give us the space to prepare our health services and prepare ourselves in other ways as well, getting PPE and laboratory tests in. And was it a perfect response? No, it wasn't, but it really did give us that breathing space, and we flattened the curve. We gave ourselves time. The other thing about giving ourselves time was that by the time we hit our peak in July, we had the benefit of all of the experience that other countries such as Italy and the UK had learned by then, including how better to treat people. And we understood more about the importance of things like masks and what we needed for sanitizers and how we could do ventilation that would be appropriate. So, it gave us all of that time, not only to prepare, but also to have the benefit of global wisdom that's fortunately growing all the time.
And those were lessons learned from the first wave. What should South Africa be looking out for now that Europe and America are going through a second wave?
Well, I think that we were all initially sort of optimistic that perhaps we wouldn't have a second wave, or how bad it would be. I think now most of us think we will have some second waves. What we're seeing at the moment are clusters of cases. We saw the outbreak that occurred around a nightclub in Cape Town. We're going to see these clusters and these outbreaks. Now, if these start to become more frequent and they start to grow, then we're going to build up to a second wave. We don't know when that will happen. It might be a couple of months. It might only be, say, at the beginning of next year. But I think just talking amongst the public health experts in the country and the Ministry of Health, everyone is very concerned about December because we're worried that people will be going on holiday, having the summer feeling and the phew, we got through that year kind of feeling, and what a year it's been, and that people's behavior will change. And if the behavior changes, then we might well see that what happens in December is that we do get a second wave. And because people are likely to go home, we might see clusters of cases in communities that have previously not had many cases.
And just on the issue of the second wave, what is the definition of a second wave? Because I recall a few weeks ago when we were seeing about 1,000 new COVID-19 cases as far as what's been confirmed by the health department, right? In the past week, we've seen an average of about 2,000, and some experts are saying, yes, it's an increase, but not quite second wave level yet. So how do we define a second wave?
It's a very good question, and it's one that, in fact, was being discussed at a meeting of the Ministerial Advisory Committee just last week. So the modelers are looking hard into this because what we are seeing are these little peaks and then this gradual increase. So we're looking at the moment at the definitions and when we would call it a second wave. But at the moment, it's not a second wave. We are seeing these clusters of cases. And we're watching carefully that overall number because if the overall number keeps going up, then it will become a second wave. But as I say, this is something that our local experts are currently looking at to see how we would define that and when we would say we are definitely in the second wave. We're not there yet, but we are seeing clusters of cases.
All right, Professor Helen Rees, chairperson of the South African Health Products Regulatory Authority, thank you for your time tonight.